Hey guys, this is Dr. Hub. Today we are looking at the management of the male infertility. So in terms of the male infertility, the first step will be to do the semen examination. So from the semen examination, let's look at some normal findings. So in terms of the normal findings, there is the IUI for 3 to 6 cycles. So in terms of IUI for 3 to 6 cycles, so under this, we look for the sperm count greater than 10 million. So if the sperm count is greater than 10 million per ml, so here there is without ovarian stimulation. So this is without ovarian stimulation. Next is with the clomiphene or the letrozole. This is with the clomiphene or the letrozole, and with the HCG. Now let's look at the failed IUI. So under the normal findings in failed IUI, there is the IVF. So in terms of the IVF, the count which is greater than 10 to the power 6 and the progressive motile sperms, and in terms of the progressive motile sperms. Next is ICSI. So ICSI, if the count is 0.5 into 10 to the power 6, 0.5 into 10 to the power 6 and in progressive sperms. Now, on the contrary, let's look at the abnormal findings. So under the abnormal findings, there is the investigations. So in investigations, we look for the hormonal FSH, there is LH, there is E2, as well as the prolactin. Then comes the testosterone. Then we also go for the ultrasound and the biopsy. Then what is done is we go for the correction, then the failure.